Hello everyone, Dr. Mark Russo from Naples Nephrology. Today I'm going to be discussing one of the most important things that you're going to have to keep an eye on, and that is your access for dialysis. Please know that some of you may have a tunneled catheter in your chest wall that goes into the internal jugular vein, and that's how we utilize the bloodstream to clean your blood. We cannot use peripheral veins, they're too small. And if we use them over and over again, they will become necrotic and they will become stone-like, and we won't be able to utilize them again. So therefore, that's one of the reasons why we have to use a large vein. But we don't like leaving that access in for a long time because there has been shown to have an increased risk of infections. Patients do not get very good dialysis. And if you do get an infection, it's directly in your bloodstream and it will wind up on one of your heart valves. And some patients have had to have heart valve replacement and don't do very well with that surgery or even after that surgery. So we want to be preventative here. And that's why we want you to have a fistula or a graft. Many of you will have started dialysis with a fistula, and a fistula is where we just hook the artery or attach the artery directly to the vein. It's called arterialization of the vein, making the vein thicker so it allows for access to continue, allows the needles to go in on over and over again on a regular basis. So that's why we do creation of the fistula. This access needs to be followed on a regular basis. Please know that we want you to continue to follow up with your surgeon. He or she needs to do an ultrasound on it on a regular basis, maybe every 3 months, maybe every 6 months. So this way we can identify problems before they occur. That access or that fistula could become enlarged, and that's called aneurysm. It may develop an aneurysmal type of behavior. If it gets too large, it may need to be ligated or cut down, but we'll leave that up to the surgeon to make that decision. This is your lifeblood. This is your lifeline. You shouldn't let anybody draw any blood in that arm. You shouldn't let anybody put an IV in that arm. You shouldn't let anybody touch that arm with a blood pressure cuff. God forbid you get admitted to the hospital or you go into the hospital. Anyone comes there near that arm that has the access in it, whether it be a fistula or a graft, unless they're shaking your hand, that's the only thing there to put on it, maybe a wristband, and that's it. Please keep them away from it. General medical issues. Anytime a physician starts a medication that's outside of dialysis, please remind him or her that the dose of the medication needs to be adjusted. Many of these medications stick around for a long period of time, especially in individuals that you're diabetic. Let's be cautious with that. We don't want to overdose. You wouldn't overdose yourself with insulin before you're on dialysis. So therefore, we don't want to do it while you're on dialysis or after. So that you do run the risk. There is the potential for that insulin to stay around longer or other diabetic medications. So you're at increased risk of low blood sugars. And so we want to make sure that you check them on a frequent basis. Don't hesitate to bring that to our attention. And any questions that come up, please don't hesitate to ask any one of our staff, any one of the nurses. We have dietitians here, social workers that will be more than happy to spend time with you, giving you that information that's necessary to keep you healthy and around getting, whether this be the final stop before you leave the planet, or whether or not this is going to be used as just a bridge prior to you getting a transplant. So let's live long, let's live healthy, and let's work together. Remember, we're all on the same team. And even though we have differences in our jobs on what we do, we're all here for you. Thank you, and you have a wonderful day.